Welcome to Igniting Change, the podcast where we explore innovation, industry trends, and how tech for good is solving the world's biggest challenges. Let's get into it.
Thank you so much for joining us. Did you want to introduce yourself for our guests today?
Sure. Thank you so much, Puff. My name is Leah Ekbladh. I'm the Executive Director of Digital Square.
And Leah, how did you get that role that you're in today?
How far do you want to go back?
We'll go right the way back. Come on.
Yeah, well, I'll maybe start where how I got into public health and then maybe how that morphed into why I think digital is so important in global public health. So I fell into public health almost 30 years ago. And I was actually a foreign language major as an undergraduate. I was a Russian major. I got my first job because I was Russian-ish enough or could speak well enough that I started working at a small nonprofit out of Johns Hopkins University. And I was willing to get on a plane and go work in Uzbekistan. So I was really fortunate to be incredibly mentored by a group of folks there and worked for many, many years there, mostly in that part of the world, and really understood how important public health was in emerging spaces and emerging markets and in emerging health systems. And I got the bug. And from there, because I was luckily working for a Johns Hopkins affiliate, kind of got the right types of education to do that going forward, and then worked in global health from then on in. And then kind of dove into digital about a decade later, or a decade ago, I should say, not a decade later, because there was a middle decade in between those three. And I was working on a program to support tuberculosis diagnosis and treatment. We had a large program going on in Nigeria. And it was about the same time that molecular technologies were being put in laboratories across the continent and across the world with investments from the Global Fund and investments from WHO and USAID and others. And it was very exciting because drug-resistant tuberculosis was going to be able to be diagnosed in 90 minutes instead of the 3 days it would take to culture a sample. And we thought about all of the loss to follow-up that wasn't going to happen subsequently, the speed with which people would be able to get onto treatment and be cured was really exciting. And watching these instruments kind of produce their first diagnostic test results was exciting. And then it went into a gigantic paper log register. And I thought, well, that's not going to speed things up at all. I may have said that with an expletive rather than that, but in case there are youngsters listening. And what was ironic about it is this technology also came with a laptop and a LIMS port. And I was not a techie person at all, but luckily had some techie folks working with me. And they very brilliantly said, I think we can figure out a way to build some software to get these really critical pieces of data out of this machine and into the hands of the people who ordered the test in the first place, aka the physicians, and really help speed the turnaround time from the diagnostic test result to people getting the drugs they need, and then hopefully not spreading it further and having it cured. And even over that period of time where we were working on this, we thought, wow, as we get these in aggregate and we can anonymize the information, we can see village level data, regional level data, population level data, national level data, to be able to kind of also predict where things may happen. And then can supply chains follow, drug follow-up follow, can, all of these things that are happening in the health system that would support a diagnostic test result and support that patient along their treatment journey. These are all things we can gain insights to if the information can move around and be in the hands of the people who need to make these decisions. And that's where I think technology can so help in any health system, whether it be in the United States, whether it be in Nigeria, whether it be in the Philippines. If we can get the right information to the right people at the right time to make clinical decisions, to make planning decisions, to make supply chain decisions, we can really move the needle on health equity. So that's why I got really excited about tech, even though I haven't coded a thing in my entire life. When there's like Girls Week coding at school and my kids come home and they're using Scratch and I'm like, how did you make that little potato get legs and dance around? Like, I have no idea how they do that. So luckily I work with a bunch of other people who do. But what I think is really important are those wraparound services and thinking about the infrastructure and the governance that need to wrap around technology to make it useful. Because if you just drop it in vertically, it's not good. Just like if you drop in that diagnostic instrument without the wraparound, wasn't going to help anybody. So thinking about it systemically and holistically, I think is really exciting and important. And is what I get to do every day, which is such a gift.
You know what? You talk about it with such enthusiasm and such passion like that. You had the biggest smile on your face when you were it just shows that you genuinely love what you do. But the way that you were describing this, Leah, you make it sound really, really simple, but actually it's incredibly complicated because when you're taking data from one piece and you're trying to, it's that wraparound, right? It's all of that stuff around it. But actually, and it was funny just hearing you talk about the fact that you were like, oh, I'm not technical, but you have the understanding of what people need. And quite often, I think that's maybe arguably more important than actually being technically minded, because then you know what the solution, how that solution needs to function, right? So, but then the how that happens, that's where you need the tech help, because quite often technology isn't the answer. It's an enabler. Right. It can enable things to happen.
That's right.
It's not actually the solution itself.
That's right. And if you think about, I certainly didn't do anything I just said on my own. I was certainly a backup singer. And the teams of people that you bring in, but it's also not the teams of people you import from, my American accent from the US, for example. I mean, if you don't have the Ministry of Health of country X on your side, if you don't have the governance champion in that country on your side, if you don't have the local knowledge and expertise to be fed into the solution, if you don't get the end users to tell you what works well and doesn't work well, again, you can create something that you hope will be an enabler, but it may not be an enabler. So it does take a large team of folks who have various skills and skill sets, and we have to listen to one another. And I think that is hands down the best part of my job, is working with this, multidisciplinary team on a day-to-day basis. So.
Which I might add that anyone out there listening today, working in whether it's software design, development, one of the biggest challenges that people have is around stakeholder management. But I feel like that's what you're saying. You love working with all these different stakeholders and essentially aligning them, which is really, really hard.
Yeah. And again, I don't want to say me, and that's what I do. It's what our team does for sure. Right. And without that, you also tend to develop things that nobody wants. And I think one of the things that I'm so privileged to be part of with Digital Square is that we are led by what countries tell us is needed, not by what we think is needed in a vacuum, or not what donors tell us they think is needed in a vacuum, but really being able to seek out country context and country leadership and listen to that and work with them in partnership to get things on the ground.
So talk to us about the mission of Digital Square and why it was founded.
Such my privilege to do that. I am actually Digital Square's 4th executive director, I believe. So I'm relatively new in this position. So I'm hoping I can do it justice for all those that came before me, because I am certainly standing, as we say, on the shoulders of giants. But Digital Square's mission is to coordinate investments in digital health systems and technologies to improve health outcomes in low and middle income countries. And it really seeks to drive that in a couple of ways. So one is through effective development and scaling through the use of global goods, which are open software tools and tools that are adaptable to local contexts and are interoperable and sustainable, but then also being able to, again, wrap that kind of governance and infrastructure around those tools to make sure that they are fit for purpose in those low and middle income countries that we're working in.
Gosh. So how did you get into Digital Square? Talk to me about that in a little bit more detail.
Well, for all of my colleagues out there who are facing difficult times, I was actually laid off from my last job. and spent some time consulting, actually, and kind of just kicking some tires to figure out where I would land next. And I very fortunately got some work at Path, which is where Digital Square is housed, and was able to kind of work in tandem with Digital Square for quite some time, several months before I was hired, to work on their implementation arm. So they have, we have these different result areas, and one of them was on this implementation arm, and then actually took a step back from Digital Square and worked and still work in the Center of Digital and Data Excellence at Path, where then Digital Square is housed, and worked on our strategy. So I was in charge of thinking about what the Center of Digital and Data's Excellence's strategy ought to be, and thinking about what the digital strategy for Path ought to be. And then Digital Square obviously nested into that. So worked a lot with the Digital Square team to think that through and figure out what types of investments we could pursue together, as we were chasing after that strategy. And then from there, as other people kind of moved and shifted in the world, as you often do, I was able to take on the ED position in September and really just give it all of my time, which has been great.
Oh my gosh. I mean, but again, I can't decide, Leah, if you're just one of the most passionate and happy people I've ever, or if this is just, you genuinely loving what you do. Because I
think it's both. If you're passionate about what you do and you get to do it, you're going to be happy. Yeah.
Have you always known that you wanted to be in this space? Or are you, because you said earlier, you kind of like fell into this space. And I think, to be honest with you, in the tech for good space that's quite common. Like people don't necessarily realize what kind of opportunities are there, but actually they get an opportunity and then they just keep leaning into it more. And, I guess it just gets better when you can actually see the impact that you're having.
I mean, I think I was very lucky that, right out of my undergraduate work in the late 90s, I was able to kind of work in public health right away. And it was a time in global health where, they ship people who look like me over to the countries to work. And I got to spend a lot of time working in the countries where these programs were being housed. And I think as soon as I was able to do that, I don't think I was a couple of months into my first job and I'm like, oh, this is what I want to be when I grow up. This is what I want to do. And I really, truly can't imagine doing anything else 30 years later, except maybe in retirement being a swim coach. So my other passion. So yeah, I think I just fell into the right thing at the right time, and it was the right thing for me, and I just got lucky that way, I guess.
So, and this wasn't in the questions that were sent over earlier, so I apologize.
That's okay.
And for any of our listeners right now, I have put Leah on the spot. What would you, so for anyone listening today that wanted to get into this space right now, like what one piece of advice would you give to them?
Don't be afraid of the climate that we're in at the moment. We're going to pivot and it's going to pass.
Oh my God.
So if you're going and getting your MPH or you're going and trying to get your first job in public health, just do it. Don't look back. I think the closer you can get to where the work is done, if you get the opportunity to do that, either paid or if you're lucky enough and are able to do it unpaid, please go do it, because doing it from thousands of miles away is not the same. And if you aren't able to do that, making sure that you're hyper aware of the people who are, and you're listening to them and you're following their lead, especially when you're starting out fresh. Because there's no better way to learn than from the people who are there doing it on the ground day to day.
I mean, and again, for you listeners at home, before we got onto the podcast recording, something that really struck me as we were talking was the resilience that I think this whole space has, especially right now. I know like everyone is feeling it right now, but just like the resilience, the sheer strength that is in this space is just absolutely incredible.
Yeah. Well, like you were saying, the work is not easy. So people who stick it out, I think, have that passionate drive. It's like teachers who have the calling, right? Or physicians or nurses that have the calling. I feel like many of us who work in this space also feel that same way. And something when we were all kind of reeling in this a couple of months ago when things were happening, I had a colleague who said, we're really lucky that we have been working in, so-called development for so long, because one thing that people in this space know how to do is pivot in a crisis. And I think many of us are relying on that muscle that we've built up over time, because this is a different kind of crisis. It was a sudden crisis, but it's not our first one. So we'll get through it.
I love that. Love that. Right. So coming back to Digital Square. So am I right in thinking Digital Square was born out of the Ebola crisis? So, how did that shape its approach to digital health solutions?
Yeah, that's a great question. So I usually, when people ask me this question, I try to kind of take them on a timeline, because I feel like thinking about it over the course of a timeline can be really helpful. So in the early 2000s, before Digital Square was born, I guess, the global health landscape really had significant challenges in achieving equitable access to technology solutions, particularly ones that needed to be supported in public health systems. So you see a lot of kind of vertical technologies being put into countries, and some of those technologies may have just been a laptop in a static center where people may have been doing digital entry. So they were digitizing stuff, but there was no way for that information to be shared across other clinics or to travel with a patient. So they weren't digitalized yet. And where you kind of see things move ahead is, kind of between 2005 and say 2015, so that kind of decade of time, a lot of donor organizations focus on funding digital health tools to meet kind of high priority needs in countries with emerging systems. So you see a lot of people kind of putting in things specifically for HIV or specifically for tuberculosis or specifically for whatever vertical health, well, we call them health verticals that you can think of. But again, like we weren't kind of seeing a lot of people coordinating in those spaces. And certainly the TB space and the HIV space and the cervical cancer space and all of the different ones, they weren't talking to one another. So you see a lot of these efforts were fragmented, they lacked coordination, they resulted in sometimes duplication and really limited reuse of effective technologies. So you see a lot of pilots fail, right? People were kind of talking about that technology graveyard. And then, I'm getting to the Ebola part, I promise.
It's really interesting. You talking about like, basically there's loads of failed pilots and you called it the graveyard, right? Do people actually talk about these failures? Like, do they talk about them publicly?
Yeah, I think so. I mean, I think a lot more maybe 10 years ago, because I think we've learned from those failures and we're seeing fewer of them. So maybe you're not talking about them or hearing as much about them today, because I think we're doing a much better job of being able to take those initial inputs and those initial, we don't even call them pilots anymore because that kind of started to become a bad word, but we see a lot more things going to scale. And I think, again, that was kind of catalyzed. I'm going back to that Ebola example or kind of what kicked it off is that, in 2014 to 2016, we see this Ebola epidemic happen in West Africa. And the gaps that I was talking about before about things being verticalized and fragmented, I mean, these gaps just were absolutely exposed. I mean, you just saw them, you could see them from the United States, right? Like they were really exacerbated. And like during that crisis, governments really rapidly deployed new technology platforms to try to keep up with the information, right? So you see human resource management and contact tracing and asset tracking functions and platforms being thrown in these countries to try to curb the spread. And again, these platforms were siloed and they were standalone systems. They didn't integrate or share information. And because of that lack of coordination, there was just more confusion. And I think many of these solutions were introduced without considering the affected countries' existing infrastructure and including their IT infrastructure. And that resulted in a lot of ineffective or again, duplicative implementations. And I think these issues really underscored the need for a coordinated approach to emphasize what could be scalable, what could be interoperable, and what could be reused, what was already on the ground. And then enter Digital Square. So in 2016, USAID, or the United States Agency for International Development, and the Bill and Melinda Gates Foundation helped Digital Square get off the ground, again, under the leadership of PATH, which is the organization that we sit in. But we do have 31 partners. So again, kind of back to that partner coordination and knowing we can't do it alone. But it was essentially created to address that fragmentation in the digital health space. So at the time, many digital health initiatives were being implemented in silos, and again, leading to that duplication of effort, limiting that scalability, and then really just kind of exacerbating sustainability challenges. So Digital Square's goals were multifold, right? There were really kind of four of them. So one was to promote global coordination. So again, moving all of those right people around to make the right decisions and bringing together the governments, the donors, the tech developers to collaborate on digital health technologies that could be scaled and adapted across different health systems. It was really to drive investment efficiency. So again, it was to coordinate funding from multiple stakeholders and avoid duplicative investments and streamline the development of digital tools, really promote and encourage interoperability. So that was kind of the third thing there, and support the development of digital health solutions that are interoperable, ensuring that data can be shared across platforms and that data was being used efficiently. So kind of, again, taking it to that implementation stage, making sure it really can impact health systems and service delivery. And then finally, and I think this is something that we're really trying to focus on now, is really enhancing that sustainability piece. So Digital Square is in its 9th year and really trying to think and focus on those long-term solutions that can be maintained and adapted by countries to meet their specific health needs as they change over time, right? The digital health space that was in country X 9 years ago looks very different today. So we want to think about that rather than relying on those short-term or project-based solutions. So our hope is that by focusing on these open source adaptable digital tools, we can improve health system effectiveness and ensure better health outcomes in these limited settings and really kind of close that equity gap in healthcare.
Oh my gosh, you're doing so much. It sounds like there's a massive team behind this. I know you mentioned like 31 partners, but like,
Yeah.
is it a big team or is it a really
Yeah.
nimble?
It is ebbed and flowed over time, depending upon
Yeah.
our own funding environment. I think at its peak, it was probably around 90 folks. It's usually, I think, kind of, I think the median where we often like settle in is usually around 60 to 70. And sadly, we're a little smaller at the moment. But yeah, it's a big team. And we're all doing different things. And most of us do not sit in the United States. I think that's really important for folks listening to know. So yeah, I get up at all types of day to support the team. and they for me, probably they for me even more so. So yeah.
But navigating those time zones are not for the faint-hearted, I think.
No, I thank goodness that that's been digitalized, right? You can get on the world clock and put in everybody's time zone and figure out what works for the
Yeah,
masses.
I just felt having to do it manually. I'm a bit like, oh.
That's right.
So because of this, I guess you're going to be at the cutting edge of some like amazing, really promising solutions. What are like, can you share any information about some of the most promising tech-driven
Oh
solutions?
my goodness, I can give you a whole guidebook full of them. So my colleague, who I'm gonna name by name because he's done such an amazing job stewarding this for many, many years. But my colleague Carl Faree, who's out of South Africa, leads up he was our deputy director for technical services, but he also leads up our global goods team. And we have what is called the Global Goods Guidebook, where there are 41 tech solutions that have worked with Digital Square and have met the criteria to be a global good. And I wish Carl was here to dive in a little bit more. It may be even worth having a whole global goods session someday, but essentially they need to be open source. They need to be working on standards that are interoperable, and they need to be scalable. And there are other things that we dive deeper into, but just for the sake of simplicity. And there are 41 currently. There is not a country in the world right now that doesn't use a global good, at least one, including the one where you're sitting and where I'm sitting.
Wow.
So really have driven a lot of impact, and I think have really set the foundation in so many countries, because some of them go back, even predate Digital Square, but have really kind of set the foundation for digitalizing healthcare and pushing toward digital transformation in the countries where we work and reducing that fragmentation. Because the beauty of these products and services is that they are open source. So as things evolve, other places can build on top of them. We're seeing private sector entities use them as foundational tools to build their tech on top of. We've seen governments say, hey, these other functionalities need to happen with this foundational tool, and they bring in their Kenyan entrepreneurs to build on top of them. So they've really been critical in setting those foundations for sending these countries on their digital transformation journeys.
So if we've got someone listening right now that's like, I want more information, where do they go to get more information?
Yeah. So if you go to digitalsquare.org, you will find somewhere in that nomenclature. The Global Goods Guidebook does have its own domain because we want to make sure it lives beyond Digital Square.
And
yes, it's Global Goods Guidebook, all one word, goods are plural.org.
Fantastic. And what we'll do is we put the links in the bio.
Great.
Awesome. Okay. Yeah. Right. Okay. So next question. How do you balance innovation with the reality that many global health systems still lack quite basic infrastructure?
Yeah. Well, again, a point I can't drive home enough is that we don't do this in a vacuum. We don't take a technology that we think is promising for Burkina Faso without talking to Burkina Faso and knowing how it would work in Burkina Faso and knowing that Burkina Faso wants this technology. So I think we spend a lot of time and energy, and I think people who don't spend this time and energy don't meet the same success, right? So I think, we know what the technology landscape looks like. We know what the infrastructure looks like before we go in and put anything on the ground. And again, Digital Square is not putting it in on the ground, right? We're just moving the pieces around. So one of the things we're ultimately trying to avoid is introducing or pushing a technology that will not work there. So again, I think because we as Digital Square take a very neutral stance on the technology solutions themselves, and we work with countries on their national digital health roadmaps, we identify with countries what those needs are, and then we can help figure out what the fit for purpose technologies are, and then we let them do it. We walk away, we're hoping that by building a lot of these these governance structures and processes and working with the governments themselves, that they're choosing solutions that are fit for purpose for the infrastructure that they currently have. Or if you want to kind of look forward, they're also choosing technologies that as their infrastructure becomes stronger, can adapt to that evolving infrastructure and the evolving needs of the health system. It's the only way to do it.
And I totally agree and echo that, because just the way that you're talking about it, again, it feels like it's quite straightforward and it makes sense, right? That's the way it should be. But often the reality is there are stakeholders that can get excited about specific features or things, and they'll get caught up on that, and they're not thinking about the bigger picture. And is this actually going to work? And is this right? And I think you really need what we would call strong product leadership, and that focus on the people that are actually using the products to make sure that you're delivering on something that people really need.
Yeah, right. And, our global goods are not digital squares, right? Path as digital square, we have developed none of them. All of these global goods are stewarded by other organizations and other developers who also hold those truths, right? So you'll see that, some of our global goods partners also go in and help implement in countries. Other of them just build communities around their products, and then those communities go into the implementation. So you see, even within our global goods community, there are different approaches that work for different places, and there are different products and services that work for different places. But as being part of that global goods community, the stewards of those products and services, I think, really fall in lockstep with that mantra. And I think in large part why they've been so successful.
Amazing. That neutrality. Yes, I love it. Right. Okay. What's the next big thing in tech for good, right? So if you could change one thing about how the global health sector approaches funding and technology, what would it be?
I only get to choose one thing.
Yes, I know. I'm sure there would be many, but yeah, what?
Yeah, I love this question, because my gut reaction is one thing, but then that one thing I think cascades into so many other things, just like health technology cascades into so many other things. You got to localize it.
Come on, explain.
Yeah. So I think, again, we've really earnestly tried to not develop tech in a vacuum and not support tech in a vacuum. But I think you'll see a lot of our global goods technologies, and a lot of the technologies that are foundational in many of these countries don't come from the countries themselves. And that's okay. Sometimes getting something from somewhere else makes the most sense. But I think we're seeing such a rapid evolution of the tech space, of the health space in so many of these countries, that you're seeing a lot of really promising entrepreneurial talent come out of these countries. And I think we can really be helpful in brokering a lot of partnerships between some of the global goods that are already on the ground and some of these entrepreneurs who are trying to take it further, so that you don't throw the baby out with the bathwater. Don't throw away what's already there. Reuse what's already there, so you can really expedite what needs to come next. And I think thinking about localizing those partnerships is really important. I think there's demand coming from country government to localize those partnerships. And I think it is also a really important way for us to think about sustainability for the future, as localizing those partnerships. So lean into the localization. I know it's been rhetoric for a few years now, and I think we're making progress on it. It's not just rhetoric, but I think it's time to really put the pedal to the metal on the localization front, because we're seeing, obviously big donor priorities shifting, and we're going to have to figure out ways to make up for some of those shifts. And I think, again, localizing it is one of the ways that we're going to survive some of these shifts. And then I think as you localize it, recognizing that those who are going to be kind of picking up the difference in some of those donor gaps may not be another donor. Maybe it's different types of capital that's existent in a country or on the continent. And we need to give them a longer runway. We need to find metrics that ensure that measure it beyond lives saves or health impact, right? There are many important measures along the way that should allow investors to give us a longer time to make it work, and to make it work well, and to keep it on the ground. So I think localize it, give it a longer runway, measure it beyond DALYs and QALYs, and then find ways to make these folks investment ready beyond donors, right? Whether it be getting it directly paid by government, whether it's thinking about some impact financing along the way, whether it's thinking about how do you get private sector folks to pay for it. Let's think about some other ways that we can diversify funding for these folks, and maybe using those donor investments to de-risk the entry into market and the scale into market. But we gotta think beyond donors at this point.
And you
I went beyond one because you have to.
I mean, you did. I let you. It was
okay.
just.
I know. I didn't see you doing the,
No,
chopping off at the neck signal.
No. I'm getting excited. So for anyone that can't see the visual cues, because obviously there's a video on. So you were talking about funding and that longer runway, okay, and giving people more time to get to what success looks like, whatever that metric or measures are. I think there's two things for me. One is being really clear on what success looks like, because I think it's very, very easy to go into new projects and having those measures blurred or not really defined. But I think when the measures are very clear, it's so much easier to be like, yeah, cool, this works. We need to scale up or do more or whatever. But it just makes it so much easier. The second thing is, and this is one of the challenges that we find that our clients face. So because, we work with lots of not-for-profits globally. And one of the things that honestly, if I'm going to be really blunt, it really frustrates me that the traditional funding is like, here's your one and done, right? This is a pot of money and you have to do X, Y, and Z and you've got that funding. But when you're creating a digital product, like you're not just creating it, you need to keep it alive. And there's often ongoing costs associated with that, like hosting or support or CI, like continuous improvement. And I just don't think like all funding models are set up for that. And
Correct.
Quite often, especially in the not-for-profit space, people are so risk averse into, launching or adopting a digital product, whatever it might be, because there's just the nervousness of who's going to fund the ongoing costs associated with this. And I almost feel like there needs to be more done in terms of education around digital products and what funding models could look like for digital products, because it just, admittedly, things are definitely improving, and I've seen some incredible work from, and I always say them because I'm a fangirl of what the work that they do, but the Patrick McGovern Foundation and the work and how they fund AI projects and stuff like that. So it's just there needs to be this whole education piece. So I'm just going off on a
I'm gonna put up my perpendicular lines with my hands. So I'm gonna agree and disagree.
Okay.
So I think there have been many investors or donors who have actually put in for the long game. And I will say up until very recently, USAID was one of our biggest long game supporters, and so grateful to our partners there. And I think that the Bill and Melinda Gates Foundation has also been a long-term, long runway supporter, along with many of our other investors, to the point where we've almost been alive for 10 years because of these investments. I think where we start to struggle, and where I'm going to agree with you, is when you think about not investing in the digital squares of the world, but investing in one of the stewards of the global goods or one of these other entrepreneurs who are building on top of a global good and have a supplemental product or service. That's where you start to get people be very risk averse to taking that chance. And I don't think the countries are super risk averse anymore. I think they see the utility of digitalizing health systems, and they're hungry for it, and they're hungry for systems that will work and that are affordable. But I think where you start to get people nervous is a specific product or service, or like, let's choose a winner. And I think that's where, kind of the global health development market has made things a little bit tricky, because it's not a market. It's not a traditional market, right? And I think that that's where we need to start cracking the net, where I'll agree with you again that there need to be different types of funding models going forward and thinking about this. Because when you're saying, there are these ongoing costs, I'm going to channel Carl again, where he said open source is free, but it's free like a puppy, right? You can get the puppy for free at the shelter, but then you got to feed it and you got to take it to the vet and you've got to take it for a walk. And there are all of these financial and opportunity costs to keep it alive and healthy. And I think those get put by the wayside when a project ends. So what happens when the project ends? And that's where I think we need longer runways and more patient capital or more patient donors coming into play. Anyway.
No,
yeah.
it's good. And I agree. That puppy analogy, I have to admit, I have used that before.
Yeah. You mean Carl didn't come up with it? I'm going to have to tell him that.
But it's so true, it sounds good. So open source, it does, I smile, everyone gets really excited. I'm like, it's great, but like there's a load of they're not necessarily hidden, but they are to some people. Like if you're new to this space, like they're just not always front of mind. And I think it's just, making people aware that there's a whole other, there's just lots of different elements to keeping these digital products alive.
For sure.
So, but right. So you mentioned USAID, and obviously very topical. So with USAID funding gone right now, like what does the future look like for initiatives for Digital Square?
Yeah. So I'm going to say first and foremost that Digital Square is very lucky. Digital Square has multiple investors besides the US government. So our lights are still on. We are still here. We are still making our world go round, the world that we're trying to support. We're certainly doing it more slowly without USAID support. We're certainly doing it with a smaller team without USAID support. They were about half of our funding portfolio. So I don't want to say it's all roses over here, but we are still here by the grace of some of our other financial supporters. We're going to have to figure out how to replace some of that. And I say some of it only because I don't think there's another donor on the world that can replace what the US government had put into this space. But that being said, going back to those of us work in development know how to pivot. We're going to figure out how to pivot. We're going to have to pivot through different partnerships. We're going to have to think more about how do we partner with the private sector? How do we partner with other non-traditional philanthropic or donor-supported initiatives? Again, very luckily, we had kind of started thinking that through about a year ago, maybe a little bit more, because we knew our global goods community needed that first and foremost. So I think we're really just going to, for lack of a better word, lean in on that and really try to make sure that we can build up in a different way while we kind of pick up the pieces. I hope that's a balance between the tragedy that just happened, but without sounding too Pollyanna to move forward, because do
you know what, Leah, it's really inspirational because I know like our clients, so many people out there in our network, in this space are struggling. They're just struggling right now, whether or not they've been financially impacted or whether like there's just so many people have been affected. And I think
for sure
the resilience that you are showing and just the being able to pivot and being able to use that muscle, I think is a wonderful like attitude to have. So yeah, I think you've got that balance just right.
Thank you. Well, we learn so much from our children, for those of us out there who are parents. And I think about when my child gets really upset about something and I'm thinking, why are they so upset about this? Don't they know it's going to be okay? And, when you're 10, you don't know it's going to be okay, right? You haven't lived through it before. You haven't known that there's another side. Well, we've never seen anything quite like this. We've gotten through other crises before. And I think knowing that we can get through the other side is helpful. That being said, while watching hundreds, if not thousands of our compatriots be out of work or not be able to do what they feel like was contributing to this space is really painful. And I think we need to acknowledge that they're out there and they're in pain. Those of us who get to remain to continue to fight on and rebuild it so they can come back is our goal.
Absolutely. And I know, so we have, and we're trying to build this Tech for Good network globally, right? So if we have listeners out there that want to get involved in supporting global health solutions, like what would you suggest?
Oh, this is such a great question. So I think if you are a technologist, you probably already know about platforms like GitHub and OpenHIE and the Digital Public Goods Alliance. But there are ways to contribute that technical knowledge right then and there without trying to go through too many hoops. And then I think if they're only technical on TV, like I am, use whatever social media you use whatever blogs you write, use whatever public forums that you use to amplify the stories of successful global health initiatives and the impact of digital health solutions. Like keep sharing those stories, even if they're old stories, reshare them. And then I think there's a good old fashioned way, depending upon what country you live in, of engaging with policymakers and global health organizations to really emphasize the need for this long-term support that we were talking about for digital health, for digital public infrastructure, which is a big thing kind of on folks' mind, particularly at the World Health Organization, and for health initiatives at large, right? It's not just the digital space that is reeling from all of this. There are other kids need vaccines, people on HIV need their drugs. So, just write those letters, make those phone calls. What I understand is sending emails and making texts don't work, but pick up the phone. So,
It does make a difference when you pick up the phone versus
it does.
email or reaching out.
Apparently it does. I mean, you learn all these things, but yeah, I think analog in this case.
I know, yeah. Right, Leah, thank you so much for spending the time with us today.
This was fun. It's always great to have a captive audience to talk about things that we feel so good about. And it was cathartic too, given the circumstances. So I really appreciate it.
Thank you.